Good morning to those of you on the West Coast, and good afternoon to those of you on the East Coast. Welcome to the Pathways Research and Training Center's September 29th webinar, Family Support for Transition-Aged Youth. I'm John Osowski, the Dissemination Manager for Pathways, and I'd like to begin with a few housekeeping announcements. Please see the advice on the slide in front of you to make the most of your GoToWebinar experience. In particular, please note that during the presentation, all audience members will be muted, but you can send your questions to us via the chat feature. A recording of this webinar will be made available online shortly after this webinar ends and will be available from the link shown on the slide below. That's pathwaysrtc.pdx.edu/previous webinars, or webinars-previous. We'll have that up again for you all. And we'd like to invite everyone who registered for this webinar to stay in touch with Pathways RTC by signing up for our monthly RTC Updates newsletter. We feature links to Pathways resources like this webinar and other news and events of interest to the field. You'll receive an invitation email after the webinar, and we hope that you'll click and accept it. This webinar was made possible with funding from SAMHSA, the Substance Abuse and Mental Health Services Administration, and NIDLR, the National Institute on Disability, Independent Living, and Rehabilitation Research. And so welcome to today's webinar, Family Support for Transition-Aged Youth. Our objectives today are for participants to be able to use research-based knowledge of family experiences to better support young adults with mental health challenges, assess the impact of cultural background on the experiences of these families, better support families, including young adults with mental health lived experience, access training opportunities and resources that will help families better support young people, and identify needed research and training that will help participants better address the needs of young adults and their families. And helping us meet those objectives today is our distinguished panel of presenters. I'll just say a few words about them here and let them have some time to introduce themselves as their section begins. We have on the line today Eileen Brennan, Assistant Professor at Indiana University. We have Lori Serrar, Executive Director of Allies with Families in Utah. Eileen Brennan, a Research Professor with Pathways to Positive Futures here at Portland State. Lisa Lambert, the Executive Director of the Parent Professional Advocacy Lead in Massachusetts. Nicholas Bukia, Research Assistant, Pathways to Positive Futures at Portland State. And myself, the Dissemination Manager here at Pathways. And with that, I'd like to start off today with inviting Nick to share with us a bit about his experiences as a young adult with lived experience.
Hello, John.
Hey, Nick, how's it going?
It's going pretty good. Glad to be here.
Great. Glad you could join us. Could you start by telling us a little bit about your own experience with family?
Yeah, well, I just want to make it clear that I'm a young adult who made it through the mental health system. I'm still in the mental health system. Experienced psychosis about 5 years ago. And I wanted to illustrate how family is so important. My mom was with me all the way while going through psychosis and making it out. I remember I dropped out of college, and she just sort of held my hand as I was losing my mind, quite literally. And she helped me get back into school, along with ESA, the Early Assessment and Support Alliance, and I'll go into what ESA means later on.
Great.
But yeah, it was really my mom treating me more like I was a child again, because I had the function, of the capacity of, and the imagination of a child. I wasn't my adult self. I was 22 at the time, so I was a young adult, but I definitely wasn't in my mature state that I hope to be in now. That is. Okay. Yeah, it was really my mom and my whole family that really helped out tremendously.
Great, and I understand that through ESA you've also worked alongside other young adults who experience mental health conditions. And how do you think their experience of family is similar or different from yours?
Well, I know family isn't always a go-to for some folk. Some people don't have a family to turn to, and they don't have a mom to walk them through the reality that they're living in and help them recover. Some people have parents that are that have been absent or have been bad figures in their lives, and so I know it's different. My father was one of those people who was a bit absent in my life a little bit. He was always there loving me, but it was really, I could turn to my mother as a figure of firm support. And so I do sympathize for people who have who don't have the support, because I had that on one side, but I also had the other, so I can relate to both.
I see. And so based on all that, in your opinion, what do you think are the roles of families?
Well, the roles of family, it's easy. It's to love. The main idea is love and support throughout life, throughout adulthood, and into as far as death, as far as it goes. Really, you just need to love your family and love your parents and I have a brother and sister. I love them very much. And I just wanted to back up a little bit about my father. Even though he was a bit absent at times, I still love him tremendously. And so I think it's just that love that keeps us alive and keeps the hope for us there. I know that you don't get a lot of love from service providers at times. Other times you do. ISA was tremendous because they have that same sort of love that any family would have.
Great. So before we talk a little bit about ISA, would you mind sharing some ideas that you have about family of choice?
Yeah, so because you can't choose your family, and because circumstances just sort of drop you in the world where you're at, being able to choose your family is another important thing. I chose my girlfriend. She helped me tremendously. Sarah, on that picture, as you can see, I got really lucky, and she helped motivate me, and she also helped me return to school and finish and apply for this Pathways job at PSU that I have. And I work with ISA, and so I've sort of come full circle in this whole process. But being able to choose family was very important, because I would have never been down this path of coming full circle.
Well, let's talk a little bit about ISA then. I'm going to just add some information here on the slide. Do you want to say a few words about your work with ISA and what ISA is?
Yeah, so ISA is the Early Assessment and Support Alliance. It treats people who are new to psychosis, and psychosis, just in the broadest definition, is the loss of reality. And I say it's the loss of your own reality from how you viewed your reality before. So I had this very defined idea of what life was, but then it drastically changed, and then I'm back into how I viewed it before. So the past, returning to my past view is also part of the definition, I believe, because everyone has their idea of what reality is, but really losing touch of what your past reality was and then making it back to that reality. I feel like ISA really helps navigate.
Great.
And the way they help navigate getting back into your normal, quote-unquote, normal state of mind is they have psychiatrists, occupational therapists, art counselors, job specialists, just a whole array of different approaches, not just one approach of psychiatry, which is equally important. It's the whole team working together. So there isn't very much of a hierarchy going on there. And
they involve the voices of youth too, don't they?
Yeah, they involve a lot of the youth. Like what I do now with ISA is they take our input and voice, and they really listen to us, and we advise them how to go about this system in a different way, such as more peer support, because there wasn't a lot of peer support when I was there, but studies have shown, and we know just personally, that seeing someone who has gone through the system and who's gone through psychosis, seeing them make it out, is probably the most warming thing anyone could feel, because you feel like there's no hope, but seeing someone that's made it through, it can be very compassionate.
Perfect. Well, Nick, I want to thank you very much for that introduction to today, and I'm hoping you can stick around for our question and answer session at the end.
Of course. Thank you. Sorry my voice was a little shaky. It's because I'm so excited about this project. Thank you, John.
It's great. No, I think you did very well. And now we're going to move on to Anna-Maria Brennan with Indiana University, who is going to address caregiver strain. Anna-Maria?
Hi, folks. This is Anna-Maria. I've been doing children's mental health services research for a long time, and I'm particularly interested in families and what their role is and how we need to support them primarily. My voice is also shaky because I'm excited too. So next. Next slide, please. Thank you. So my job here today is to provide just a little bit of the research literature in this area, trying to understand what we know about families of transition-age youth with behavioral health challenges, and to talk about some of the, what we know and what we don't know, and try to make some recommendations. Next slide. So I think it's important to note that there's a pretty good-sized literature on how families experience the caring and supporting of people, relatives with behavioral health challenges. And one body of research are the adult children, adult relatives, the families of adult relatives with behavioral health challenges. And another even larger body of research are among the families of minor-age children. So while there's been a fair bit of work in those broad areas, there's almost no work, I'm almost prepared to say there's no work on families of transition-age youth. And so I think that, and we can assume that there's some very different experiences there. Next slide. So the research tells us that their families who are helping to support their relatives with behavioral health challenges experience both negative and positive impacts. So among the enriching experiences that families describe is that they describe having a closer relationship with God or a more rewarding spiritual life. They talk about how their family has gotten closer and stronger because they've been able to unite to address the challenges that they're facing. And they also talk about having this kind of more inclusive, broader, more accepting worldview that enriches their lives. But I will say that most of the research done in this area has actually been about the challenges that families experience. Next slide. And that's going to be the focus of most of what we talk about today. So we know really clearly from the research that relatives who are supporting people, folks with behavioral health challenges really do have extra caregiving responsibilities that other families don't face. They're more likely to have financial strain, for example. They're more likely to experience disrupted relationships within the family as well as in their extended family and even in the community with their friends and other places. The most commonly reported challenges that family members describe is feeling worried, feeling guilty, and feeling just tired all the time. And there's also a sense often of this fear of what's going to happen to my loved one. How is that person's future going to unroll? How is my family going to do in the future while we're facing these challenges? So we have a name for that. The name in the field used to describe kind of these extra caregiving responsibilities is caregiver strain. And there are different kinds of caregiver strain, and some of them are like, well, you know that they're happening out there, and you can drop into a household and see that it's happening. We call that objective strain. We can see that there's a disrupted relationship here. We can see that they're having financial struggles. Anyone can witness it and see that it's happening. And then there's also subjective strain that has to do more with how a person feels internally about those things. Next slide. We have done a fair bit of research on what contributes to strain. So we know that the primary contributor, the thing that probably shapes strain more than anything else, is the severity of the symptoms and the functioning of the relative that has the behavioral health challenge. But we also know that as caregivers, as youth grow up, that strain and the relationship between the strain and the symptoms changes. So for example, since we're talking about transition age youth, there's pretty good research that caregivers of older teenagers are more likely to describe the kind of subjective strain that's more related to kind of anger, feeling of anger, of embarrassment, kind of those negative kinds of feelings. So there's something there that we haven't pursued that we should probably do more research on. But actually, being a mother of a teenager, I also can say that most caregivers probably experience some of those things with their teen children anyway. So we do also know what can help protect against caregiver strain. For example, having adequate resources to support the family and help bolster them and provide the resources they need to support the young person in their life with behavioral health challenges, that helps, that reduces strain. Also, we know that when a caregiver or family has to interact with the service system and they're feeling these barriers to care, some of them are attitudinal, some of them are physical, or time and location and those sorts of things. But once they encounter those barriers, they're more likely to feel more strained, regardless of how severe their young person's illness is. We also know that caregivers who report feeling more empowered, to feel like they have more control over these things and have more agency as they navigate the system, those caregivers report having less caregiver strain. So we know of some of the things that will help protect families and caregivers from strain. Next slide. And then we know that caregiver strain actually impacts employment, which is pretty important if you think about it. If we know that adequate resources helps protect against strain, then feeling the kind of strain that leads to disruptions in employment means that there's a loss of resources. So there's this tumbling of this cycle of loss that can happen under these circumstances. So for example, one of the things we've learned is that the more severe the young person, this is the research in the minor age youth, the more severe the symptoms are, the more likely the caregiver is to report not having adequate child care and having a child who's has more absences from school. And those things seem to contribute to the likelihood that that parent is not going to work anymore, is not going to be working outside. Another thing we've learned is that for caregivers who have worked recently, they report that they're less likely to work outside the home, even though they have worked recently. So we presume that they want to work. They are less likely to work outside the home. And if they do work outside the home, they're more likely to reduce hours that they're working. They're more likely to change jobs so that they can accommodate the extra caregiving demands that they meet. And they might also quit their job altogether or be dismissed because because of the challenge of balancing their extra caregiving demands with their employment. Next slide. Caregiver strain has been shown very consistently to have a really important impact on the way that young people use the services that are available to them. So for example, if you have two families and let's say the research says that the children are very similar, so they have the same level of severity, same kind of social functioning severity, but the caregivers are experiencing different levels of strain. The caregivers that are experiencing more strain are more likely to have kids who actually use a mental health service, the children are more likely to use a residential placement. And you'd think that they would use similar service patterns because they have similar kinds of symptoms, but the strain really starts to shape how services are used. And then also children of caregivers who are more strained also have received more services and they incur higher costs of care. So we definitely have evidence that quite apart from what the children's needs are, how families are experiencing that is important. Next slide. Another very interesting finding that needs a lot more research is that very consistently in both the adult and the child mental health literature, African American caregivers report less strain. There's been speculation that that's maybe because African Americans are more likely to have a larger support system, have more extended family, but the research is not clear about that, and in fact some research has indicated that that isn't the case at all. So we don't really understand why that's the case. There's been one study that showed that it has something to do, might have something to do with how African American caregivers experience strain as related to those internalizing symptoms like worry and sadness and depression that young people sometimes experience, that African American caregivers in this one study experienced increases in strain at a slower rate when the child, related to the child's increase in internalizing problems. So there seems to be some relationship there that we have to kind of get a better understanding for. And then I suspect, we need some more research, but I suspect that this difference in caregiver strain partially explains why it is that caregivers, African American caregivers, children of African American caregivers are less likely to use formal services. And we don't really understand it, but there seems to be some connection there. Next slide, please. Some of the important literature around outcomes is that when caregivers who show up with their children, again, controlling for the severity of the children's symptoms, the caregivers who report more strain, their children are less likely to experience clinical deterioration over time. We don't really know that, but it might be that because the strain that the caregiver's feeling supports them in their drive to get the services that the child needs, and the child gets more services, and so they get better. We don't understand it, but we think it's important. And then even better hope is that there's one study that I found that was where they used a parent-to-parent peer support program to support parents, and it was a relatively non-intensive program where a caregiver spoke to another peer on the phone once a week for a brief time, a half hour or something like that. So to me it seemed like it was not a very potent intervention, but in fact for those caregivers who were more strained, if they received that support, they reported less strain over time, and most importantly, their children experienced gains in reading, even though that intervention had provided no direct services to children whatsoever. So there's some hope here that if we make the effort, we can really support families, and that's going to help the family and the caregiver, and it's going to help the young person. Next slide, please. So I think that the upshot here is that, first of all, we need a lot more research on these issues related to those families that are trying to support transition-age youth. I think those issues are going to be different, and they're important for us to consider. But also, I think that the research suggests that if we support families while they're trying to support their relative, their young person, then we're going to be able to improve procedural outcomes, service processes, and we're going to be able to improve outcomes for youth and families. So I'll stay on the phone, and I'll be happy to answer any questions if you have them at the end of this session.
And thank you very much, Anna Maria. And with that, I'd like to turn it over to Lori Serrar.
Hi, I'm Lori Serrar. I'm the Executive Director of Allies with Families, and we're the Utah chapter of the Federation of Families for Children's Mental Health. And I appreciate the opportunity to present our curriculum to you today. One of the values at Allies with Families is that educated parents make better choices, and so this curriculum the purpose of this curriculum is to give parents that empowerment and the education that they need to move forward. Next slide. Our curriculum is called Growing Up Without Growing Apart. It's a curriculum that Allies developed with the help of parents who were experiencing raising a youth with a behavioral health challenge through their transition to adulthood. The curriculum was designed around particular areas of interest for these parents in our group, things that they wish that they had known that would have helped the transition experience be more successful for them and for their young adult. We were funded at the time by the state of Utah through a Healthy Transitions initiative from SAMHSA. Next slide. In section 1, we talk about the types of relationships, independent, dependent, codependent, and interdependent. And understanding those and what the characteristics of a healthy relationship are helps to define your relationship with your young adult and what possible changes need to happen. We also talk about taking care of yourself. We begin this part by talking in the terms of the need to put on your own oxygen mask before helping others. We talk about how you can take care of yourself by understanding how to manage stress and tips on time management. Gary McKay, PhD, says, you have the capacity to choose what you think about. If you choose to think about your past hurts, you will continue to feel bad. While it's true you can't change the effect past influences had on you once, you can change the effect they have on you now. An important concept to learn so everyone can move forward and not be stuck in the past. This section goes into understanding the grief process and why it's important to recognize and validate, and to understand what is a normal response, because there is no normal response. Next slide. Our next section talks about person-centered planning or youth-guided wraparound. Both of our processes or structures that assist young people to plan, set goals, and implement those goals. As you can see on the slides, we answer each of those questions: what, why, when, and who. We also talk about the difference between a system-centered plan versus a person-centered plan. Next slide. Section 3 is all about education. We go over the basic tenets of the ideal law, including what the parents' rights and responsibilities are, and the transition requirements under IDEA. One of the major tips given to parents in this section is the importance of keeping records, to write down the good things that happen as well as the challenges. It empowers parents in meetings with professionals to have things written that document their concerns and highlight the young adult's strengths. Parents know their child better than anyone else and will be the one constant factor throughout the life or throughout their child's transition from school to adulthood. Their commitment to the IEP transition team is the key to making their child's transition to adult living a successful one. This section includes a lot of transition tips for parents, and we also cover Section 504 from the Americans with Disabilities Act and how those accommodations can follow the young adult to college and to work. Finally, we describe exiting the school system and what role parents can play as a mentor in the post-secondary school experience. We also touch on the rule of who is the legal parent when the child is or the young adult is aging out of custody. Next slide. This was an important section for our group of parents. All of these issues you can see on this slide are issues that parents need to know. They just need to know about at the very least. Guardianship and estate planning take some time to plan and implement, and there are several ways to accomplish both. The siblings of our young adults will have the longest relationship with them, and it's important for them to do some planning so that they won't feel like it's a burden to have to care for their brother or sister financially or otherwise when their parents are no longer here. HIPAA rules are important to understand. I remember the first time they told me I couldn't participate without my son's permission, and it was devastating to me, so this would have been helpful for me. Next slide. Dreaming new dreams and loosening up. Our biggest and probably loudest discussion came when deciding between loosening up and letting go. Samuel Johnson says nothing will ever be attempted if all possible objections must first be overcome. Parents' fears about physical or emotional harm are real, But protecting young people from reasonable risks robs them of an opportunity to become as independent as possible as they transition to adulthood. The negative consequences of shielding young adults from taking risks can be more damaging than the consequences of an occasional mistake or failure. Parents will be less traumatized if you view loosening up as a process and use transition planning to provide an approach that lays adequate groundwork for successful independence. Prevention planning is critical in the transition planning process. Next slide. Greater independence means greater risk, and risk-taking is essential for the long-term development of social and personal competence. We all grew up taking risks, and we all learned from those risks. Next slide. Adolescence can be summed up in one word: change. Only infants grow and change as rapidly and extensively as do adolescents. Understanding adolescent development, how children mature between the ages of 9 and 21, how those changes affect their families and other people around them, and how the surrounding culture and society influences that development is critical to planning and implementing programs that can give teens the tools and skills they need to make and carry out responsible decisions. Next slide. So as not to confuse you, Section 7, which I did not make a slide for, is an activity for parents and their young adults to begin to fill out a transition timeline. Section 8 is an optional class that talks about foster care and what parents need to know if their child or youth goes into custody. The information for this class was taken from a curriculum written by Georgetown University a few years ago. We only cover this class if there is, if that's who our audience is. Next slide. I just want to finish with this poem by an anonymous author. I see children as kites. You spend a lifetime trying to get them off the ground. You run with them until you are both breathless. They crash, they hit the rooftop. You patch and you comfort. You adjust and you teach. You watch them lifted by the wind and assure them that someday they'll fly. Finally, they are airborne, and they need more string, and you keep letting it out. But with each twist of the ball of twine, there is a sadness that goes with the joy. The kite becomes more distant, and you know that it won't be long before that string will snap, and the lifeline that holds you together will no longer be the same. A child, as a kite, must be prepared to soar, as they are meant to soar, free and alone, and to the greatest extent possible. And only then can we collectively say that we have done our job. Thank you, and I will also be around at the end if you have questions.
Thank you very much, Lori, for that. Next up is Lisa Lambert. Lisa?
Hi, and thanks for including me as well. I'm the director of the family-run organization in Massachusetts, just as Lori is in Utah. And I'm also the parent, as Lori mentioned about herself, of a young man who's now an adult and has had mental health issues since he was in elementary school. So the transition was a time for me of sort of nervousness and wondering how things would go. What we decided to do, and what I'll talk about a little bit today, is create a legal guide for families. Some of the sections Lori's covered, I won't talk about those, but we've seen a lot of legal guides out there and none quite what we wanted for our families, so that was the impetus to develop this. Next slide. So one of the things that we began with as a sort of a premise or a guiding principle is that a lot of times I think we've seen providers, at least in my state and I know in other states, who think that parents can sort of have one foot in or one foot out. It's sort of an either-or proposition. But in reality, what families tell us is that they have many different kinds of roles. Some of them are substantial roles depending on how old their young adult is. It's a different role when they're 19 than if they're 26. and also depending on what the needs and the skills of the young adult are. Some of them, of course, are navigating many complicated systems and might need some help with that. And some roles are more minor and more of a supporting kind of a role. I think Nick said at the beginning he had a parent who was involved and a parent who wasn't involved as much, and we see that a lot too, and tried to define that parents can have a role even if the role is relatively small. The other thing we found out in talking to families is that the culture of the family really affects what kind of a role they might have. We all know parents parent in different ways, and sometimes culture has a lot to do with that. We have two great people in my office, Norma, who's from Colombia, and Hannah, who's from Ghana, and they talk to a lot of families who are from diverse cultures here in our area, and some of them, some of the families are very authoritative, and they say, I know what's best, and this is the way it goes, and they're going to have a different opinion about transition. And Norma says in her culture, you're always the parent's baby. It doesn't matter whether you are 10 or whether you're 25 or you're 50, and that's the way she sort of looks at things. So that's something that I think we should all keep in mind. We also started out with the principle that parents can agree or disagree. Sometimes you're not the supporter. Sometimes you're the person who says, really, that's your idea of a good choice? And that's okay. It's okay to disagree. All families disagree and do just fine. You know, not everybody wants to make the same choice about what to eat for dinner or something else. And it's okay to disagree as long as we're respectful of one another. And then the other thing to keep in mind is that there's often younger siblings at home, and when parents make a decision for the family, they're thinking about the entire family, and very appropriately, young people and youth are trying to make decisions that are about themselves, and sometimes that's something to keep in mind as well. Next slide. So we sat down here, and one of the people who helped write the guide is a woman who is on my board of directors who's an attorney and has a daughter who's in high school who's going through the transition. And we tried to think about the different roles that parents can and do play. And sometimes it's just creating a space, stepping back a little bit, and that would be a more supportive role, as I mentioned, the different types of roles. Sometimes it's emotionally supporting, loving, as Nick had mentioned earlier, or just being vocally supportive. Wow, that was a really good idea. I'm really glad you went ahead and tried that out. Financial support can wax and wane, especially we're hearing a lot about that nationally. Insurance advocacy. I know with my own son, he came to a point when he was about 19 years old where he went to the pharmacy to get his medication, and he needed a prior authorization because the formulary rules in the insurance company had changed. And he said, I thought about not taking the meds. And then I thought, you're good with insurance, Mom. So he asked me to be his insurance advocate, which I did. And I called and, you know, got the forms filled out and talked to the prescriber and all of those kinds of things. And he learned along with that, but he didn't have that skill set right away. Lori mentioned a role as being a special education advocate or a higher education advocate for your young person if it's needed. To keep looking and assessing and adjusting that relationship is a very important thing. Brainstorming that's really individualized, you know, around vision, but also around skill set and around good fit, because I think that's a really important thing to talk about. Making sure that the youth has a voice. Sometimes it's just nodding. Sometimes that's all that, at least with my son, sometimes that's all that they want to do at that moment. Providing a personal medical history, sometimes what families can do. When my son transitioned to an adult internist, we had an agreement that I would go in and help him fill out the family history form that his grandfather had heart disease, for instance, because he couldn't keep it all in his mind. He was feeling anxious about the transition. And then I stepped completely away while he decided, you know, what it was that he wanted to say or you know, important to him about his health. Parents need to start learning youth-friendly language instead of just parent-friendly language. And also, I think that when providers ask families, for instance, what do you think to families, or asking for that family history, that shows they value family involvement, and that's a really good thing to see. Next slide. So the legal guide looks like this. You can download it, as you can see, off of our website. And we have seen a lot of legal guides for youth or for parents whose youth had, for instance, intellectual disabilities or medical needs. And they were really slanted in that direction. And we wanted to create a legal guide that really looked more at some of the domains and areas that we thought were important for families whose youth had behavioral health needs. So it's a quick guide. We focus more on legal decision making than any other arena, and we realize that the landscape changes continuously. The Affordable Care Act has changed insurance coverage, and I'll talk a little bit more about this. The reauthorization last spring of the ABLE Act has really provided some opportunities for families and young people as well around finances. Next slide, please. So the Affordable Care Act, or Obamacare as it's called in the press, allows young adults to stay on their parents' insurance until age 26. And this has really helped a lot of young people to become insured, and insured often with a fairly good plan. I think the data last year was that this was the largest group who had formerly been uninsured that is now insured. And of course that changes your health care options once you have insurance. I mentioned my own role in taking on the role of, my own experience in taking on the role of an insurance advocate, which some families do because they've had that experience all along. Hopefully, it's learning that can be passed along. And some families that we know, their young people find it intimidating to initially make appointments and do some of the follow-up, the routine follow-up. And maybe, they start with calling in for a prescription to be refilled. And that can go slowly, where there's sort of a hybrid of responsibility, which slowly can move over towards that young person. One of our recommendations is to think about healthcare proxies and think about releases, which can give parents a certain role. Where we started this guide with thinking about, as I said, all of these arenas where you can have a role for families, and it can be limited or it can be more expansive. And those are things to talk about. It's a good place to really talk about what roles the parent and what roles the young person will assume. Next slide. So financial decision making can be, again, it can be a combination, or it can be something that gradually shifts over depending on both what the family has done so far and what people's skill set is, I guess. One of the things many families do is set up a joint bank account, or some sort of bank account where both the parent and the young person has input. When my son first started with his own bank account, he needed it to be linked to his savings account, which would reduce all of his fees or eliminate his fees. So we linked it to mine, and I can see into his bank account. I don't do anything but look when I need to make reporting to somebody on how his spending went. But there have been times when that's been really, really helpful. Some youth can sustain employment, but they might need help in figuring out what to do with that paycheck every week. In a custodial account, which is different than a joint account, the parent might have more control, and that might be what's needed depending on how that young person is doing, what their skill set is, because we don't want anyone to lose their housing or not be able to eat because that wasn't really thought through. Supplemental needs trusts can be implemented in order not to jeopardize benefits, and that's when the young person has entitlements so that they can either inherit or have money in their name and it not be jeopardized because it's set up in a certain way that satisfies the legal requirement. And some parents act as representative payees if the son or daughter is not able to pay all their bills or manage what they need to for the month or for the period of time that the money is supposed to cover. And next slide.
And Lisa, I'm just going to have to ask that we kind of wrap up this section maybe in the next minute or so, because we want to leave some time for questions. We're just running a little behind today. I'm sorry about that.
That's okay. So I will just very quickly say that the ABLE Act was passed last year, and each state has to pass legislation that supports it. If you go to the ARC, I think most people know what the ARC is, the ARC.org, and look at their public policy section, they are tracking it state by state. And many states are allowing a savings up to $300,000 for some young people who are, there's some restrictions around it, who are using the ABLE account. Next slide. And again, HIPAA, Lori mentioned it very, very briefly, but HIPAA often is not practiced the way that the law is. There's a big disparity between how it's interpreted on the ground. And HIPAA also can be really important in protecting people's privacy, but if it's misinterpreted, it also restricts communication where it doesn't always need to. So the U.S. Department of Health and Human Services did issue a guide which clarifies how that communication can go. And I will say Congressman Doris Mitsui has legislation pending which sort of codifies what HHS said. And in the meantime, there can be HIPAA releases which allow people to, family or friends, to be able to be involved with some of that information and health information sharing. Next slide. And I think this is my last slide, so just quickly to sort of recap, decision making can change as that young person gets older. Sometimes also as they manage whatever is going on in their life better, so their skill set and everything grows and grows. They might want to assume complete responsibility in something like making healthcare decisions and treatment decisions, but want someone else to help them with other things like insurance advocacy. So framing that role, making those decisions is really, really important, and doing it thoughtfully and doing it clearly and transparently. And as I mentioned, the reason we did the legal guide is once you have a clear understanding of what the legal options are, it's a lot easier to be able to make those decisions and have everybody feel that their role is exactly how they want it to be. And I'm set.
Great, thanks so much, Lisa. And I'd like to turn things over now to Eileen Brennan.
Thanks, John. A team of Pathways staff, including myself, Pauline Giovangi, Claudia Selmeyer, and Maria Carolina Gonzalez-Prats, has designed an online training program we'd like to talk about today, Promoting Positive Pathways to Adulthood. It's going to be available for the first time this October in its entirety. And the modules were developed in consultation with the Pathways Transition Training Partnership, which is a national advisory group of service providers, researchers, young adults, and family members. Next slide, please. The focus of the training program is to support service providers who are working with young people age 14 through 29 who have serious mental health conditions and their families. And it will help us to provide specialized, research-based, interactive training experiences for the people who participate. The service providers we hope to engage are those providing mental health supports, peer support specialists, parent support providers, and others working with young people and their families. And what we hope to do is to move participant knowledge and skill development into improved practices with the young people and their families. Next slide, please. So there are 10 free hour-long training modules in our Pathways Training Partnerships online training program. The first two modules focus on skills necessary to build partnerships with young people and work with them to promote their recovery and wellness. Modules 3, 4, and 5 focus on providing culturally appropriate and effective services, and they include video segments from leading service providers in the Native American, African American, and Hispanic communities. Module 6 discusses research-based information on brain development and trauma-informed services. Module 7 considers recovery of social relationships as part of wellness and discusses the specific needs of lesbian, gay, bisexual, and transgender young people. Module 8 develops knowledge and skills to bridge gaps in services, and 9 helps service providers to build the support young people want and need from their families, peer supporters, and mentors. And we conclude with Module 10, which examines positive youth development and fosters youth participation in service design, evaluation, and quality improvement of services. Next slide, please. So if you're wondering how you can access this free online training, you can do it through your organization or directly from the Pathways website. Each interactive module includes research-based information, interactive exercises, and probably the most important and the most helpful are video recordings of interviews with young adults, service providers, family members, cultural leaders, and advocates. And each module concludes with a knowledge quiz, and those who successfully complete the quiz for each module may print out a certificate of completion for that module. Next slide, please. So beginning this fall, the Pathways Transition Training Partnership is recruiting additional partner organizations where a team of staff will agree to participate in the online training series, engage in team-based exercises and discussions of the content, and complete a simple training evaluation. The Pathways team is also developing supplementary training resources to accompany the modules and an evaluation of training outcomes. So we'd really like to invite you to participate in this process, and if you're interested, please contact me at eileen@pdx.edu or call me at 503-725-5003. Thanks a lot.
Great, and thank you, Eileen. I believe we have about 9 or 10 minutes left for some questions that we've received. I have a few here from me, but first I guess I should announce that on the slide that had the legal guide on it, unfortunately we put the wrong link in there. I'm sure Lisa will send us the correct one, and I'll make sure that that gets archived with the archive of the correct slides. So our apologies for that error. So I guess the first question, I'll open it up to our panel. How would you balance family concerns versus minor consent to treatment?
I suppose I'll go. Well, there were times when my mom wanted to be in the conversation, but I guess I wasn't a minor, but I was still not wanting her to be in the conversation, like with my therapist. And so I think I just want to speak to the fact that there are times when I want family involved, but there are other times when I feel like it's private. So I feel like it's important to have that consent from my perspective.
All right, thank you, Nick. Do any of the other panelists would like to weigh in on this?
Hi, this is Lisa. I think, again, that if you sort of pare it down to the particulars of the role, because, for instance, my son didn't also not want me to be involved with treatment decisions, but it was okay for him to know, for me to know that he was on medication because he needed help with that. So when we reduced it down to really specific things, and where he was okay and comfortable with involvement and where he wasn't, there was a lot less conflict than if we made it a big thing and say either yes or either no.
I agree.
All right. Any other panelists care to weigh in? Okay, well then maybe we'll move on to the next question. What advocacy can be done to prevent early discharge from treatment resulting in relapse?
This is Lisa again. Is that a question about the advocacy with the whoever's funding it, or the advocacy with the young person to stay in it? I'm not sure I understand.
Well, I'm going to ask the questioner to kind of, if they would like to write back in for a little clarification on that one. But the question is, the way I interpret it is, maybe there's a situation where there is an early discharge from treatment that could potentially result in relapse, and how could someone advocate for not having that early discharge happen?
So I think that's kind of ironic that it's an advocacy for being in treatment, or I mean being not discharged, because the goal is to be discharged. The goal is to be set, stable, and to have your team behind you. The goal shouldn't be to say, let's keep this person in the hospital for as long as possible because they're going to relapse. The attitude should be, let's set this person up with people such as ESA, an outpatient program that keeps the individual within society, because the relationships are strong in ESA, and so if they can have that relationship outside of any hospital setting, then that's one way to prevent relapse, because the people know it's a familiar bond.
Right. That support is what you're saying.
The support is there.
Gotcha. Any other panelists care to chime in about that one too?
When we talk with families who are worried about the goals the schools have set, we always ask for the data, and that may be a question that you might want to ask. But I agree that the goal would be to have them outside of an inpatient setting with the proper supports.
Right. And I did get a little bit of clarification on that one. Apparently, this would be a situation where maybe the young person wasn't ready to discontinue the treatment. But let's say they needed to, there was I guess, a early discharge anyway. So I think that's what the questioner was getting at.
So I think that treatment's lifelong, and I think it's just the stages of treatment. So the bonds are always going to be there, and no one's walking away from the bonds of family and their support with their psychiatrist. They can always come back, but I think the discharge part, I think it's getting along the lines of like, how do we keep this person safe? And I think if we just keep them not like physically contained, but just have them in a network, like we were saying earlier. Just the networks are important.
Right. I think that's the gist of what we're getting from that question today. I think we have time for one more. This one is related to healthcare proxy. What do parents do when their young adult refuses to sign a healthcare proxy or releases of consents, especially when the young adult struggles with severe mental illness and substance abuse concerns?
That's a hard one. It really is. This is Lisa. Obviously, I mean, the ideal would be that you're talking about this for a long time before you need it, but that doesn't always happen. Again, I really sort of think that when you break it down to as small bits as you can, then that's the way it works the best. So if the healthcare proxy is really limited about what is agreed upon, it isn't sort of all-encompassing. Sometimes you can have a more productive discussion about that. The other thing is separate the discussion from the decision making. So you have a discussion about what it is, and then you pick a time when people aren't as what do I want to say, emotional about the topic, to say, well, what do you think? Is this something we could go forward with? And then make the decision about what to do later. Everybody has strategies for relationships. Relationships are so hard, but that's what it comes out of, the relationship. And if the relationship is so that you're quickly, trying to get something done in a short amount of time, that's often not going to work as well as if, you can have a relationship where you talk about things until you're satisfied and then make the decision. So at least that's been my experience. I have a friend who has done this really successfully with her daughter, and that's what she used, is just a discussion and then separating out a different time to make a decision.
I agree, those relationships are invaluable. I still talk to one of my He was a job specialist from ESA again, and he moved on to a different job, but I still have his phone number and I'm able to call him. So it's definitely those relationships that are patient and long-lasting.
Yeah, and that seems to be the running theme of today is relationships. Unfortunately, we are out of time now, but I wanted to acknowledge that we got some suggestions for additional resources that we will include with the slides that will be archived shortly after we close today. And we had a request to get the quote about risk-taking, and that will also be included in the slides. So I invite you to go to the Pathways RTC website after this webinar. Give us maybe an hour or two to get it up there, and we will have all of this information for you. So in closing, we did have some other additional resources we wanted to share with you. This webinar will be archived with all of those resources, and I can give you a glimpse of some of those. This is the URL at which the webinar will be available from. And we also invite you, if you have any comments or questions additionally that you would like to ask to us, please feel free to be in touch with us via email. And again, this slide deck will be available in a PDF form with the corrected link to the legal guide and all of the resources that our panelists have mentioned today. And with that, I want to thank everyone for coming and wish you all a good day. Goodbye, folks.